Great. Okay. Well, thank you all very much for joining us today on our webinar around innovation through collaboration. So I'm Amy Manning. I am a social worker and AMP by background, and we're going to use the innovation story of S12 Solutions to talk today about the journey of innovation through the NHS and social care and the support structures that are available and how they can help with spread and adoption. So we thought we'd start off today by telling you a little bit about my story of innovation so that we can use this as our case example. So I'm Amy, I'm a mental health social worker, and I've worked in local authorities since I qualified in 2009. I've worked in various settings within secondary mental health services. I'm also an approved mental health professional, an AMP, and AMPs have responsibilities and duties under the Mental Health Act. And one of the things that AMPs do is set up and undertake Mental Health Act assessments. And Mental Health Act assessments are deciding if the person who's being assessed needs to be assessed or treated in psychiatric hospital under the Mental Health Act, so to be detained under the Mental Health Act. And when we're setting up Mental Health Act assessments, we need to find 2 specialist doctors to attend the assessment with us. And it was this piece of work that has led me down this journey, and I founded S12 Solutions back in 2017. Next slide, please. So when we set up Mental Health Act assessments, we tend as AMPs to have a list of doctors who may be available to attend, and we have to ring through this list of doctors to find 2 doctors who are available at the same time to come and attend the assessment with us. And this can sometimes take hours, and worst case scenario, somebody will be left without an assessment for an entire shift where AMPs are unable to find Section 12 doctors. I had a particularly difficult shift back, I think, in 2015, where I was sitting in Bath, ringing around from my paper list, trying to find available doctors, and I couldn't find anybody. I hadn't prepared for the assessment. I hadn't read the person's story properly. I hadn't phoned their family, and I had the place of safety that was looking after this person ringing me up saying, "When are you coming?" And I was trying my best, but with the tools I had available to me, it was really limited to try and sort of speed the situation up, even though I was quite sure that somewhere there was an available Section 12 doctor. So this led me sort of down this path really about really believing that technology could provide a better way. And I had conversations with various people sort of locally, so with local AMPs and local doctors, talking about how we could move on from this paper list. And this conversation evolved, and it went up through the Mental Health Trust to the CCGs. The CCGs put me in touch with the approval panel for this group of doctors. They put me in touch with the Department of Health and Social Care, and I kept having these conversations about, this is not okay from my point of view as an AMP. I'm not working in line with the Mental Health Act Code of Practice. I'm not doing my job to the best of my ability. It's not okay for the person who needs a Mental Health Act assessment, who is probably having a really terrible time, and they're being delayed due to our out-of-date paper-based processes. And it's also not okay on the crisis care pathway, who has to manage that situation with that person whilst they're waiting for us. So that might be our colleagues in A&E, our police colleagues, or our colleagues in the mental health places of safety. So back in 2017, I had a conversation with one of the Mental Health Act leads at the Department of Health and Social Care, and we spoke about this idea about using technology to connect people up. And I had a positive conversation. Yes, this sounds good. We don't know that anyone else is doing this. We can't support you. You need to do this as an individual. So I felt really from that point onwards, I have been wearing learner badges from being a social worker to sort of stepping into this world of innovation. So with, I guess, a deep breath and a good support network, I founded S12 Solutions. We did more research to work out what exactly this problem was that we were going to solve, how big the problem was, and we developed a minimum viable product of an app and a website which connected AMPs with Section 12 doctors. And we found two sort of pioneering, brave sites to do something differently with us, one in Southwest London and one in Cumbria. So we did our pilots. The outcomes of the pilots were really successful. We had the proof of concept. We had the buy-in from the people on the ground, from our AMPs and our Section 12 doctors. And then we had different areas get in touch with us to say, you know, we hear that you're doing some work in this space. We'd like to come and get involved and be part of this. So from having initially these two sites, the platform just steadily grew, and more sites adopted the platform across the country. Next slide, please. So from there, from this initial sort of minimum viable product, we then developed the platform in collaboration with the sort of various stakeholders in this space, from the CCG, the Mental Health Trust, local authorities, and we also have an independent pool of doctors. So in addition to connecting out to Section 12 doctors, we then developed the platform further so that doctors could create GDPR compliant claim forms. We now have got electronic mental health statutory forms and video calling. So we've continued to develop the platform in line with our user needs. We have a really amazing team at S12 Solutions who I'm hugely proud of. So from starting with this idea in my mind, the S12 Solutions team is now over 20 people, and they're great. I really couldn't do this without them. So that has, you know, that's massive. That still makes me feel like I've got my learner badges on, being part of sort of a big team from coming from social services. Also on this journey, we have met the sort of various support structures who you're going to hear more about today. So I hadn't got in touch with the academic health science networks at the beginning when we were doing our pilots, partly because I didn't think what we were doing would be of interest to them. And I now realise I was very wrong with that assumption. So we met the academic health science networks, who Stuart's going to introduce shortly, and they were really, really supportive, helped us to gather evidence, helped us to develop business cases. They suggested we should get in touch and apply to be on the NHS Innovation Accelerator, the NIA. That has just been wonderful. The innovation journey and the innovation road is quite a lonely place to be. You're doing something differently, and there's lots of barriers and reasons for resistance, and you have to really believe what you're doing is the right thing. But then when you go and meet other innovators who are sort of on the same pathway, experiencing the same challenges and the same pushback, it's sort of like a breath of fresh air. And the NIA team, they're like a cheerleading squad. When something positive happens, when you've got a good news story, they'll be the first to sort of congratulate you. And on the days when things are more difficult, they'll also be there patting you back down, getting you back up, and reminding you of all of the good things that you've done so far and why you're on this journey. So being on the NIA programme has been a huge game changer. Following the NIA, we've also been on NHS England's Innovation and Technology Payment, which is part of the work that we've done with Alan, who is going to speak to us later today. And for us, having that recognition of the strategic direction of travel from NHS England has been so incredibly helpful. And there's lots of people doing innovative things, and CCGs and mental health trusts and all of these NHS organisations are having to work out what is the best fit for what they're trying to achieve. And having the backing of the NIA and the AHSNs and NHS England has been hugely, hugely helpful. So as you can see on our map here, from this idea in my mind from an office in Bath, we're now working with over 65% of England. So the blue areas on the map are live with the platform. The green areas will be live by the end of this year. And then the dark grey areas are areas that we're having sort of positive ongoing conversations with. So seeing that map makes me feel incredibly proud of all of the work that we've done. My final thoughts really are, in order to, I guess, survive being an innovator in this space, is try and get as much support around you as possible. Keep talking to people, keep listening to what people have to say. There's having an idea, and there's having an idea that other people also want to solve with you. And I think that's really important. Make sure what you're doing it's got good value for all of the various stakeholders in the system. I mentioned having learner plates on. I still feel like that now, 3 years later. I still feel like there's lots to learn, and listening and hearing and learning from other people is really, really important. And being an innovator is like being on a roller coaster, and sometimes when you have days where things go really well and people say yes and contracts get signed, like that's really, really great. And then there are other days where you feel like you've made so many phone calls and you've done lots of traveling and you don't feel like you're making any progress. It's just par of the course. I think everybody I've spoken to who's an innovator would say that roller coaster is a fair analogy. Finally, what I hear a lot from AMPS and doctor colleagues of mine is the word Luddite. And there's this, I guess, pushback sometimes around technology and working in a different way. We've all had to change hugely as a consequence of responding to COVID and responding to working from home. And we need to support our colleagues to feel confident with technology and to support them in the behaviour change. One of the sort of key learnings for me is that it's really great to have a good app that's going to help in a space, but actually if you don't support users to feel confident and to have that behavioural change, it won't get used in practice. So that behaviour change is a really important part of our work as innovators. Thank you. I'm going to pass over to Stuart.
Good morning, everybody. Thank you very much, Amy. Look, it's my role now. First of all, I'm Stuart Monk from the Southwest Academic Health Science Network down there in the Southwest Peninsula on the map. It's my role really just to give you a quick overview of the AHSN network for those of you that don't know who we are and what we do, and also talk through a couple of the nationally driven programs that we all work together on to support innovators like Amy and innovations like S12. So there you are on the map. There's 15 of us in different parts of England. We receive the bulk of our funding from NHS England and NHS Improvement, and also the Office for Life Sciences. We use this 4Cs analogy to describe the kind of crux of what we do. We're catalysts for innovation. We connect partners across sectors, create the right environment for change through our work. And also we've got this kind of collaborative spirit of working across all of the sectors in and around health and care, whether it's our NHS organisations, local authorities, academic partners, innovators in the commercial sector or voluntary community social enterprise sector. All of this kind of main aim of trying to spread, nurture and spread innovation into our health and care system. Next slide, please, Morgan. So that's an overarching mission statement for us really as 15, to try and find and then spread healthcare innovation at pace and scale, things like S12 that you've just been hearing about, all trying to meet this kind of triple aim really of improving health, driving down cost and stimulating economic growth in the country as well, which is particularly pertinent for us all at the moment. And we like our work and some of the measures that we put in place to reflect that too. Next slide, please. This slide, since we were incepted in 2013 as a network, summarises our collective impact. This is a couple of years old now, but as you'll see, lots of innovations and patients benefiting from that economic growth aspect as well, where we've been able to create jobs and leverage money whilst supporting innovators like Amy. This is all really important to our work. We really do feel like we're the glue in the system across the country when it comes to health and care innovation and nurturing and supporting spread. Next slide, please. Now look, you've heard from Amy, so I won't dwell on this for too long. S12 is one of many examples of innovations that we've supported in different ways and through different stages of the innovation development cycle and pathway. So S12 came through our colleagues who you're going to hear from shortly, Alison, Wessex AHSN's Healthcare Innovator Programme, which is for earlier stage innovations. We welcome people coming into our programmes like Wessex is there, so that we can help, provide, early stage support to you, work out the stage that you're at, and then figure out how we might sort of nudge you on your journey. Amy has also alluded to the NHS Innovation Accelerator Programme that I'll go into a bit more detail on shortly as well, and how that's played a pivotal role in her development. All 15 AHSNs in the country support the NIA. We're really proud to do so. And UCL partners work tirelessly with all of us to grow that into the excellent programme that it's become in terms of providing innovator and innovation support. And also the Innovation and Technology Payment Programme, the ITP, which again, we've been working with NHS England and NHS Improvement. You're going to hear from Alan shortly about that programme. And the Evidence Generation Fund aspect of that we've been working with Amy and S12 on to just try and build some additional evidence in a handful of pilot sites to support hopefully more widespread spread, which as you've seen on Amy's map, seems to be happening after S12 was put on that programme 18 months ago. Next slide, please, Morgan. So the NIA programme, I touched upon that, and Amy mentioned her, by the sounds of it, excellent year on the programme with some of the other fellows. She's trying to identify innovations and innovators, crucially, who want to learn and adapt their product and product offering to try and ultimately help support, spread and scale across the NHS. We're looking for innovations that have got some good clinical evidence, a good return on investment sort of story behind them, that have got some uptake in and around the NHS or health and care system more broadly somewhere, but want some additional support for a year on the programme to try and help really accelerate scale and spread. It's been running for, I think, like well over 5 years now. We've supported lots of fellows with lots of innovations across our network. And from what we hear from the innovators, certainly the ones that we've supported locally in the Southwest, it's an excellent innovator experience. The learning that you get from the other fellows is as crucial as the support that you get from the mentors and the AHSNs that are wrapped around the programme. So yeah, we're all really proud of the NIA and continue to support it. Next slide, please, Morgan. And then the Innovation and Technology Payment Programme, which in a broader sense, again, this has been running since 2017, has supported, I think, we're up to at least 20 innovations now. NHS England and NHS Improvement provide some of the central funding for these products to try and ultimately pump prime adoption of products of all different shapes and sizes. And you see a few on the screen there, patient safety devices, software, digital innovations like MyCOPD and S12 you might have come across before, where that the funding is made available for those centrally, and then it's for us as the HSN network to work with NHS England and NHS Improvement to try and support our local NHS sites to implement these as best they can, whilst in parallel trying to build business cases for future sustainability. So again, that's another key national programme and initiative that's crucial to the way that we deliver innovation spread across the country. Next slide, please. So just a final word on us, really. There's some generic information there for those of you that haven't come across the AHSN network before. Please try and identify your local AHSN as well if you want to come and talk to us in a bit more detail about the type of support that we may be able to provide to you as an innovator, or indeed to you if you're coming to us from somewhere else in the health and care system to find out a bit more about us. We want to talk to you, and we're really proud of the work that we do with innovators like Amy, so it's great to hear her story here now.
I'm Alison Griffiths and I work for Wessex HSN, and I'm going to talk about real world evaluation and implementation support in the context of S12. Next slide, please. So why evaluate? Well, evaluation plays a critical part in the innovation journey. By evaluating, we're trying to find out a number of things, and we're trying to understand whether the innovation addresses a problem that the system recognises. Can we validate the performance claims that the product or innovation is making? Does the product or innovation work as expected? And can it be improved? And what should those improvements look like? Does it have any unexpected benefits, or more importantly, any unintended consequences? Are staff and service users interested in using it? Do they find it acceptable? And is it better than their current way of working? Does it create efficiencies? Does it add value? Who benefits from those? Who will pay for it? And will people be willing to pay for it? And also, are results replicable across other areas? And would the wider system be interested in adopting? Next slide, please. So with S12, we were looking at 5 specific evaluation questions. And we were looking at the impact of the product on the setup of assessing teams. Did the innovation impact staff morale? As Amy talked about, this is a procedure that was very stressful, and that was something that Amy was trying to address through the development of the app. Was the impact on S12's doctor's experience impacted? How did S12 solutions impact on local governance processes? And did the platform result in efficiency savings? Next slide, please. So over a period of 12 months, we looked at qualitative and quantitative approaches to collect information. We looked at the system performance before and after the introduction of S12, and we allowed a 2-month settling in period before we collected any follow-up data to allow it to become established in the pathway. Data and contextual information was gathered from the local system, and baseline and follow-up questionnaires were used to obtain feedback from staff. Next slide, please. So what did we find? Well, we found out lots of interesting information, and I think it's fair to say we found more benefits than we anticipated with our original evaluation plan. We found that people were willing to engage in the system, and that most of, if not all, staff registered with the platform. Lots of attendances were booked through the system, and claim forms were submitted and paid through the system. The people found that they were happy to engage and found that the app added value in their work, that larger number of doctors registered on the app, and people and AMPs then had access to matching the doctor's skill set with the patient presenting, and were able to improve patient care through that matching that skill set more appropriately. And a common example there was people experiencing learning disabilities. We also found that there were business efficiencies, particularly around the streamlining the payment process and automating that, and admin time was reduced, but also human error that was causing problems in the previous pathways. And we also found there was improved governance. There wasn't paper forms and lists of names, but also S12 approval status was checked automatically, and this allowed doctors to be notified in advance that they might need to revalidate, and could do that in good time. Next slide, please. So we found a number of qualitative and quantitative results, and to access the evaluation and implementation support guide that we've developed, you can do that through the link on our website, which is in the bottom left hand corner, but also if you Google Wessex AHSN S12, that will also take you to that page. Next slide, please. As part of our implementation support, we also developed a guide for other organisations or teams looking or are interested in adopting S12, looking at scoping questions to better understand the system, and working through top tips and hints and lessons learned, right from knowledge into interest through to implementation to full adoption. And that's also available on our website for people to access. Thank you. I'll hand over to Stuart now.
Thank you, Alison. That's great. So we haven't had any questions posted in the chat before. I have a couple for Alison and for Amy, but before I ask those, would anybody like to come forward with anything that they'd like to follow up on with any of our presenters, based on what you just heard? If not, I'll ask my questions, which might stimulate your thinking. Amy, I have a question for you actually, as an innovator. around your learning that you've gleaned? Like what's been the single biggest thing that you've learned in your sort of innovator journey?
The single biggest thing that I've learned, I think that you always just need to be open-minded to listening to feedback and to sort of never staying still, really. I think if you don't move with the times and learn from the feedback, you'd quickly not be keeping up with what is a really fast-paced, changing landscape, with the complexity of working across STPs, ICSs, local authorities, mental health trusts, CCGs. You need to be really quite agile and not to be sort of too stuck in your thinking and what you think is the best way. It's really important to keep really actively listening and to move and to be responding to what the system needs you to do, rather than to be just doing one sort of quite inflexible solution being offered back to the system.
Super, thanks Amy, really helpful. Alison, there's been a question posted by Laura Boyd in the chat for you. Was there any evaluation or feedback from users or patients in the evaluation?
So we did consider this, but because the app actually connects staff together, I think it would have been difficult for patients to anticipate whether the app had actually made a difference to their care or not. Also, it's quite a tricky group to engage with, just given the nature of the circumstances that they're entering healthcare. Would have meant that it may have been quite difficult to access that patient feedback. However, we did engage with over 30 members of staff to gain their feedback on using the app, and that was either in person or with pre and post questionnaires.
Great, thanks Alison. Fran Butler's asked a question. The evaluation is really useful. Fran would be interested to know which organisations requested it and whether it needs to be paid for by them.
So the evaluation that Wessex AHSN undertook in this situation was actually requested by one of our local commissioners who was piloting S12 in 2 teams locally in Hampshire. And we actually provided that evaluation for free for our commissioner, working with the commissioner, Amy and her team, and also the implementing teams as well. But Wessex, for example, do have an evaluation team, and some of those evaluations will be funded and some of them will need to be paid for, but it's a bit of a mixed way of people accessing evaluations, really.
Thanks, Alison. That's very similar to the experience of myself and the team in the Southwest. We do have a small evaluation team. I mentioned at the start, in my presentation about the HSN network, that we are one of our commissioners is the Office for Life Sciences, and they ask us as AHSNs to deliver real-world evaluations for innovators like S12. So we do have some central funding coming into us as AHSNs to deliver evaluations like the one that Alison's just been describing. And we've all got our own ways as AHSNs of selecting which innovations we choose to do, probably normally based on local needs assessments, as Alison's just described. Gemma, you've just posted a question. Will there be an overall evaluation of the ITP Evidence Generation Fund programme by NHSE? Alan, that sounds like one for you to comment on around the ITP.
So for the Evidence Generation Fund, not a program level evaluation. We are frankly struggling for resources to allocate to evaluation of the program. We had planned to have 3 products or technologies supported through the Evidence Generation Fund. There are only 2 in the end. So the other one, public health personal health records, has evaluation funding built in by NHSX, who are handling that. So that's ongoing at the moment. For S12, we're in a bit more of a difficult situation and are very grateful for the work that's being done that we've just heard about here, because currently we don't have the resources to look into it in any great detail ourselves. So, which is a failing in the program ultimately, and something, as I alluded to, that we've tried to address through our newer programs, but by building more of these long-term considerations in from the start.
In kind of simple terms, Alan, I suppose if you look at the success of the Evidence Generation Fund programme being judged by whether or not those pilot sites and the success of those and the stories around those seem to be spreading into other areas, then I think that, you know, there seems to be some real value in the programme, starting with 15 and going out from there. Amy, you might have some views on that as well in terms of how it's sort of impacted on your world as an innovator.
Yeah, I mean, just before Amy jumps in, just to say, in conversation with our NHS colleagues who are sort of our internal experts in terms of digital innovation, their main metric for whether a digital innovation is successful or not is basically if people continue to commission it and if it spreads, because we don't actually have a very good way of measuring effectiveness for many of these things in any case. Sorry, Amy.
Thank you, Alan. I was almost going to say exactly what you said. So for some of the for us, when we have, like, right at the beginning, we have places who were signing up for shorter term contracts, and I guess as things have gone on, the contract lengths have been increasing with people's sort of confidence, really, and also recognition that if you're going to go and make a huge change in a pathway, in a system, you need to really invest in that, and you need to invest culturally and from a behavioural change point of view with your teams. So I would agree with Alan. I think every single site that we've worked with where the contracts have come up for renewal have renewed their contracts, and for us that's a huge evidence, I guess, that we've set out what we hoped to do, that those areas feel confident to continue working with us. So I think that's a really important and visible and a pragmatic way to see whether or not your innovation has been successful in a system. I also think, you know, looking at the work that Wessex AHSN have done, and I know that other AHSNs across the country are looking at how they can pull together evidence from their sites, which we will pull together on behalf of the sort of the ITP project, and then present back to NHS England. However, that's going to be done more of a local level than sort of being led nationally. But good question, Gemma. Thank you. Back to you, Stuart.
No, thank you, Amy, and thank you, Alan. Well, we're already running a few minutes over. I haven't seen any more questions posted in the chat. So it just remains for me to say thank you all very much for coming along and listening to Amy's story, and to the excellent work of Alison and the Wessex team on the evaluation side, and also hearing Alan and I talk about some of the infrastructural elements that exist to support innovation in and around health and care in England. Thank you all very much, and we look forward to seeing you all soon.